Dr. Atul Seth will be speaking on achieving a harmonious equilibrium between philanthropy and capitalism, which is a crucial endeavor in your practice. So over to you, sir.
Good morning, everybody, and let me start by thanking this lovely audience, because I was fearing that it's going to be the 7 of us and maybe the audiovisual guys. So I think this is a thickly attended session. Thank you very much. So I think my topic is a rather philosophical kind of sounding topic, but it isn't. Actually, though capitalism and philanthropy are seemingly opposite things, they are pretty closely interlinked. Philanthropy, by definition, is actually giving yourself in some way for the underprivileged. Now, you can divide it broadly into the 3 T's. It may be your time, your talent, and your treasure. A treasure would be the money. And I know a lot of you would say, by time, talent, jo lena le lo, but don't touch the treasure. So even the first 2 T's are good enough. Believe me, there are a lot of challenges faced by a young private practitioner. Even if it makes me sound a bit old, I'll use the phrase, in my time. So in my time, we had to start a practice. I was seeing Dr. Gandhi was showing the whole list. But at that time, we just needed a small premises, a slit lamp, an indirect and a direct ophthalmoscope, and a refraction set. And we had one man Friday who would double up as the receptionist, the OT assistant, the PRO, and believe me, sometimes even the driver. But the present day practitioner who starts is not so lucky. He's faced with a host of challenges. One is the patients expect 5-star interiors right from the beginning. We are facing competition from the corporate sharks, and if you're not planned enough, you may be gobbled up by them. These are these insurance companies who are becoming increasingly, they are becoming a bigger nuisance, and actually, I would say, giving us insulting rates, which does not justify the gigantic investment. And also, we have these educated, or should I say Google-educated patients who want the best technology for the least price. So it's not such a bad word, being capitalistic. In fact, we Bombay guys are always considered to be big capitalists, but it's not so. You can always incorporate philanthropy into that capitalism. By definition, it is someone who's running his own enterprise to make profit, and there's no sin about that. In fact, it is becoming difficult to generate profit, and this part has been covered by Dr. Gandhi already. I would just reiterate the same thing, that if you don't want to be gobbled up by a corporate, you start running your practice in a slightly corporate fashion, where you don't try to do and to be everything. And the people who are there to help you with the other things should be considered as a necessary expense. I think the capitalism has to be a compassionate capitalism, and it is not going to hurt you if you incorporate the low price segment into your practice. In fact, I would say that is going to help you justify your enormous costs by including those patients also into your practice. And one should also be, the new practitioner should be aware of, there are various schemes, and we should try and get empaneled onto them. Now, philanthropy. Philanthropy is a very heavily laden word, but it isn't. It's just, as I told you, the 3 T's. And in the initial years of your practice, what you can do is give your time and give your talent. So you could probably be a part of certain missions to the semi-urban and the rural areas on a periodic basis, where you go, you do surgeries, you have a local ophthalmologist and local personnel whom you train so that it's an ongoing process. There are these platforms like Orbis, and if you get a chance, you must offer your services. And as with time, once your practice is established and you're generally, you can say you're financially doing well, your place is doing well, then we should think about probably adding another charitable setup or a separate entity. And that's when we will have probably lesser time, lesser energy, but more money. So you can broadly, now we're talking about philanthropy and successful models. I don't think we can do it without bowing to these 3 doyens of Indian ophthalmology, who have created these 3 centers of excellence, of which we all are so proud. They have maintained excellence, and they have not compromised on quality in spite of the volumes. They are giving self-reliant service. They don't need, they're pretty self-sufficient, and they have raised the teaching standards, and they are producing such excellent and well-trained subspecialists whom we can really be proud of. But I would like to make a point that in the smaller places, all the focus is on cataract, and what I have seen is pediatric ophthalmology, glaucoma, and retina, they are a bit neglected. So these subspecialists should make an effort to offer their services by going to these places and training the local people also, so that it is an ongoing process. I have a periodic commitment to Bidra, Kutch, where I've been going from 2005, and it's a biannual commitment. And they really have absolutely no access to the pediatric ophthalmology specialist. It hurts to see simply treat, amblyopias, avoidable blindness, just because they have not been given or advised occlusion, it hurts. So I go there. My suggestion is have a set of like-minded friends. Like we take our own anesthetist, because it really wastes your time if you don't get an anesthetist there. And we do it free of charge, and these anesthetists being there helps us utilize every minute of our time. It's not that you're just giving. You go to these camps, you see such beautiful cases which you have never seen in your private practice. You learn to operate faster and with lesser resources. You get a strange sort of energy in these places. Of course, in all these national and international trips, you see a different culture. You learn a different, you know that there's a part of India, like for me, I see a part of India outside Mumbai. It's really a learning experience and a deep sense of satisfaction when you come back and you see these corrected children. There are a lot of missions, and if you get a chance to go with the Rotary International, mostly to the African countries, it's an excellent experience. I have been to Ethiopia, and we have an ongoing agreement with the Mauritian Health Ministry. Rotary sponsored it, and we go there. So I have this partner in crime, I would say, partner in philanthropy, Dr. Siddharth Kesarwani. So somebody whom you gel well with, we went there, and we really utilized our time, and in a way, we felt proud that we were representing India there. Training, we trained 2 doctors there, and now they send us the photographs. Thanks to this beautiful digital revolution, they are sending us photographs, and they send us pre-op, we suggest some things, we see the post-op photographs. So I think this teaching process also has to be focused on, not just going, doing the camps and then coming back. We should train somebody locally or invite them to come here, and we can train them in our setup and let it be an ongoing process. So here we have trained 2 doctors who have now taken over the mantle in the Subramania Bharati Eye Hospital in Mauritius. And I am sure I don't need to tell you that when you teach, you also learn. So it's that saying, when one teaches to learn, 2 people learn. I would like to end that, it is not so difficult. You should not wait till you get near your retirement to incorporate philanthropy along with your capitalistic approach. It should be in different fashions throughout as you progress in your career. And of course, again, the sharing your talent, or this, you can say teaching is the 4th T of that. And there's a beautiful saying with which I will end about teaching. It is Saraswati ke bhandar ki badi anokhi baat, jo baato त्यों त्यों बड़े, बिन बांटे घट जात. Thank you.